I want to talk to you about something that could quietly be affecting your comfort, your mobility, and even your independence as you get older. If you've ever felt heaviness in your legs, cold feet at night, tingling, cramping, or that tired, achy feeling when you walk, I want you to know this is not just getting older. And today, I want to share one vitamin that plays a critical role in blood flow to your legs, especially for seniors, and why so many people are unknowingly low in it. This video matters because good circulation is not a luxury. It's what allows you to walk confidently, heal properly, stay active, and enjoy your life without constant discomfort. And the truth is, when blood flow to the legs is compromised, it often starts quietly, long before it turns into something more serious. Before I go any further, let me ask you this. Do your legs ever feel heavy, cold, numb, or unusually tired, especially at night or after walking? Or maybe you've noticed swelling in your feet or ankles that wasn't there before. If that sounds familiar, let me know in the comments. I read them, and your experience helps others feel less alone. Now let me be very clear and responsible here. I'm not here to diagnose you, replace your doctor, or promise miracles. What I want to do is educate you, empower you, and help you understand how your body works so you can have informed conversations and make healthier choices. The vitamin I want to focus on today is vitamin B12. And I know what some of you might be thinking. I've heard of B12. Isn't that just for energy? That's a common belief, but it barely scratches the surface of what this vitamin actually does, especially for seniors and especially for blood flow in the legs. Vitamin B12 plays a central role in keeping your blood healthy. It helps your body produce red blood cells that are the right size, shape, and flexibility to move smoothly through your blood vessels. When B12 levels are low, red blood cells can become larger and less efficient. That makes it harder for them to travel through small vessels, particularly the tiny capillaries that supply your legs and feet. I want you to imagine your blood vessels like a network of roads. When traffic is flowing smoothly, everything works. But when the vehicles are oversized or damaged, congestion happens. That's what low B12 can contribute to at a microscopic level. Vitamin B12 is also essential for nerve health. The nerves in your legs rely on proper blood flow and oxygen delivery. When B12 is low, nerve signaling can suffer. This is why many seniors with B12 deficiency report numbness, tingling, burning sensations, or a feeling like they're wearing socks when they're not. That's not just uncomfortable. It can affect balance and increase the risk of falls. Now here's something that surprises many people. As we age, our ability to absorb vitamin B12 from food often declines. This is not because you're doing something wrong. It's a normal age-related change. Vitamin B12 absorption requires stomach acid and a substance called intrinsic factor. Many seniors produce less stomach acid over time. On top of that, common medications like acid reducers, heartburn medications, and even some diabetes drugs can interfere with B12 absorption. So you might be eating foods that contain B12 and still not getting enough into your system. This is one reason B12 deficiency is much more common in older adults than most people realize. When circulation in the legs isn't optimal, you may notice signs like cold feet even in warm rooms, slow healing of cuts or sores on the legs, muscle cramps at night, or pain when walking that improves with rest. These symptoms can have multiple causes, but B12 status is often overlooked. I want to pause here and say something important. If you're experiencing significant leg pain, sudden swelling, skin color changes, or wounds that don't heal, those are medical issues that deserve prompt professional attention. Please don't ignore them. What we're talking about today is supporting your body, not replacing medical care. Now let's talk about why vitamin B12 supports better blood flow in a very practical sense. First, it supports red blood cell production, which directly affects oxygen delivery. Your leg muscles are some of the largest muscles in your body. They require a lot of oxygen, especially when you walk, climb stairs, or stand for long periods. When oxygen delivery is compromised, fatigue and pain show up quickly. Second, B12 helps regulate homocysteine levels in the blood. Homocysteine is a natural amino acid, but when levels get too high, it's associated with damage to blood vessels. Healthy B12 levels help keep homocysteine in check, supporting the integrity and flexibility of your blood vessels over time. Third, B12 supports nerve insulation, called myelin. Healthy nerves send clear signals to your muscles and blood vessels, helping them respond appropriately. That coordination matters more than most people realize. Now, you might be wondering how you can tell if your B12 is low. The tricky part is that symptoms can be subtle at first. Fatigue, brain fog, balance issues, leg tingling, memory changes, or feeling weaker than usual can all be early signs. Many seniors assume these are just part of aging, but that assumption can delay helpful interventions. A simple blood test ordered by your healthcare provider can measure B12 levels. In some cases, additional markers are used to get a clearer picture. If you're concerned, it's worth discussing. Let's talk about sources of vitamin B12. Naturally, B12 is found in animal-based foods like fish, eggs, dairy, meat, and poultry. For seniors who eat smaller portions, have reduced appetite, or follow more plant-based diets, intake can be lower. In some cases, food sources are not enough due to absorption issues. That's where supplements may be considered, always in consultation with a healthcare professional. B12 supplements come in different forms, including oral tablets, sublingual forms, and injections. The right choice depends on individual needs and absorption ability. I want to stress this point. More is not always better. Vitamin supplementation should be thoughtful and appropriate. That's why medical guidance matters. Now let's zoom out for a moment because vitamins don't work in isolation. Supporting blood flow in your legs is about the whole system. Staying gently active is one of the most powerful things you can do. Walking, even at a comfortable pace, encourages circulation. When your leg muscles contract, they help push blood back toward your heart. This is sometimes called the muscle pump, and it's incredibly important for seniors. Hydration matters too. When you're dehydrated, blood becomes thicker and harder to move. Drinking adequate fluids throughout the day supports circulation in a very real way. Foot and leg positioning also play a role. Elevating your legs when resting can help reduce pooling of blood in the lower extremities. Avoid sitting for long periods without movement when possible. Even gentle ankle circles or toe lifts can make a difference. Nutrition overall matters. Vitamins like B12 work best when your body has what it needs across the board, including iron, folate, and protein. This doesn't mean perfection. It means consistency and care. I also want to acknowledge something emotional here. Many seniors feel frustrated when their legs don't work the way they used to. It can feel limiting and discouraging. I want you to hear this clearly. Taking steps to support your circulation is an act of self-respect, not weakness. You deserve to feel steady, capable, and comfortable in your body. If you're caring for an older loved one, this information matters for them too. Sometimes they won't complain, but their body is telling a story if you know how to listen. Let me circle back to vitamin B12 and why I chose to focus on it today. It's not a magic pill, but it is foundational. When B12 is adequate, your blood, nerves, and muscles can do their jobs more effectively. When it's low, many systems struggle quietly. I've seen people regain confidence in walking, feel warmer in their feet, and experience less nighttime leg discomfort after addressing B12 deficiency as part of a broader plan. That's not a promise, it's a possibility, and possibilities matter. I encourage you to take one simple step after watching this. Talk to your healthcare provider about your circulation concerns and ask whether checking your vitamin B12 status makes sense for you. Knowledge is empowering, and if this video helped you understand your body a little better, let me know in the comments. Share your experience, your questions, or even just a simple, "This helped." You're not alone in this journey, and your voice matters. Remember, caring for your circulation is caring for your independence, your comfort, and your future, and you are absolutely worth that care.